Unanisikia? Kwa sawa, nisikia? Sawa. Light inanipata vizuri. 1 2 1 2.
The gist of everything. So, ule mwenye kuna laptop, tusamee kidogo, so that, because now this is a commitment that we're giving to all our organizations. Na itakuwa inakaa fani sana tunapocheki uwasili. Sindio? We also need to sound serious the way the commitment sounds serious. That commitment is very serious. When the chairman just as we're deciding it, we send the copy to everyone. The way the chairman is a bit serious, so we also need to be serious to represent how the documents will be found. That's all. How do we? Yes. We are live now, and tungekuwa na mtu mwenye ataintroduce Alma. Who is introducing Alma?
Hivi. Here. Shut up. So, good afternoon. We finally are coming to the end of our three-day intensive advocacy triple threat training, and we want to give our commitment as young people of Kilifi County, and Alma will be reading out our commitment. I want to welcome her so that she reads on our behalf. Alma. Hello. On behalf of the Youth Voices, I'll be reading you our commitments. The Kilifi Declaration of 2024 commitments to accelerating health, well-being, and safety for adolescents and young people. We, the undersigned, commit to the following actions geared towards reducing triple threats in Kilifi County by 2027. Number 1, reduce teenage pregnancy to single figure from 14% to below 9%. Second, reduce HIV and AIDS prevalence from current 2.5% to 1.5%. 3, reduce incidence of SGBV cases from 1,837 to below 900 cases by having conducive and safe environment for everyone. To achieve the above, we commit to the following actions. Priority Area 1, fast-tracking the end of new HIV infections and AIDS among adolescent and young people. Strategic Objective 1.1, reducing new HIV infections among adolescents and young people. We undertake to integrate a multi-pronged approach to reduce HIV infections through education, peer support, advocacy, and data-driven tools. The first one, integrating age-appropriate sexuality education, AASE, in schools and communities to empower young people with knowledge about HIV prevention and sexual health. The second one, establishing peer support programs for adolescents to offer guidance and reduce stigma. The third one, advocating for policy amendments to promote access to sexual and reproductive health and rights for young people. Primary responsibility, adolescents and young people, in partnership with the county government, develop partners and community organizations. Expected output or impact, reduced HIV rates among adolescents and young people, increased awareness, and stronger support systems. Our second objective is increasing HIV prevention knowledge. We commit to enhancing knowledge about HIV prevention through engaging and accessible platforms. The first one, promoting condom use through youth friendly centers, developing informational materials on sexual health and HIV prevention through various media, using edutainment and creative arts to reach adolescents with impact messages, training healthcare professionals to provide non-judgmental counseling and services related to HIV prevention and testing. Our primary responsibility: youth organizations, health educators, and local media. Expected output: increase awareness and increased awareness and understanding of HIV prevention among adolescents. Our third objective is increasing access to HIV diagnosis and treatment. We will ensure that adolescents have access to timely and confidential HIV testing and treatment services, like expanding youth-friendly services with flexible clinical hours, organizing mobile clinics and outreach programs to young people in remote areas. Telehealth services to provide easy access to HIV-related information and utilizing the digital platforms. Advocating for free and affordable HIV testing and treatment services. Primary responsibility: county health department, NGOs, and community health workers. Output: greater access to testing and treatment leading to better health outcomes. In our priority area 2, accelerating progress to reduce adolescent pregnancies. Our first objective: reducing pregnancies among adolescent girls. We commit to empowering adolescent girls through education and access to reproductive health services, like establishing peer-led mentorship groups for guidance and on SRHR and personal development, implementing workshops on vocational skills and financial literacy to empower girls, conducting school-based SRHR awareness and campaigns to educate girls about pregnancy prevention, advocate for confidential SRHR hotlines for adolescents to access information on reproductive health services. Primary responsibility: schools, NGOs, community organizations. Output: a significant reduction in adolescent pregnancies. Our second objective is improving policy and legal environment to prevent triple threat. We will work to improve policies and laws that protect adolescents in the following areas. Number 1, organizing Know Your Rights forums to educate girls about their SRHR rights. Second, advocating for integration of comprehensive sexuality education, CSE, into schools' curricula. Third, facilitating community dialogues through challenge harmful cultural practices, facilitating community dialogues to challenge harmful cultural practices contributing to adolescent pregnancies. Our primary responsibility: legal advocates, civil society organizations, and local leaders. The expected output is a supportive legal framework ensuring the protection of adolescent rights. In our third priority area, commitments to eliminate sexual and gender-based violence, SGBV. Our first objective is to reduce SGBV cases against adolescents and young people. We will take action to reduce instances of SGBV by raising awareness and supporting survivors. In the following ways: conducting sensitization campaigns on SGBV through social media and community events, establishing peer-led clubs in groups for border shades to discuss SGBV and healthy relationships, advocate for comprehensive care packages to survivors, including medical care and psychological support. Primary responsibility, community healthcare workers, schools, and NGOs. Expected output, increase awareness and reduction of SGBV cases with survivors receiving necessary support. Our third objective, supporting policy and legal environment for SGBV survivors. We will push for reforms and services enhancing legal and medical support for SGBV survivors. Through advocate for legal aid survivors to navigate the justice system, to advocate for training for police and social workers on handling SGBV cases effectively, and to collaborate with fellow civil society to propose policy reforms for SGBV cases. Our primary responsibility, legal aid organizations, police, health services. The expected output, a strengthened legal framework ensuring justice for survivors. Priority Area 4, addressing key factors that aggravate risk, vulnerability to the triple threat. The first objective, increase mean age of sexual debate among adolescents. We will promote healthier sexual behaviors among adolescents in the following ways. The first one, creating safe spaces for counseling and delaying sexual activities. The second, addressing harmful gender norms contributing to early sexual debate. Primary responsibility. Educational institutions, youth organizations, and counselors. Expected output, an increase to the mean age of sexual debate contributing to peer health outcomes. Second objective, increase uptake of HPV vaccine among adolescent girls. We will enhance awareness and access to the HPV vaccine through the following ways. Implementing campaigns through highlighting the importance of HPV vaccine. We will be working with schools to integrate HPV vaccination into health routines. And we will be providing accurate information to dispel myths about the HIV vaccine. Our primary responsibility, health ministries, schools, community health workers. Expected impact, increased HPV vaccines rates among adolescent girls. The third objective is to increase proportion of pupils transitioning to secondary school, and we promise to support school pupils in continuing the education through the following ways. Advocate for financial assistance for secondary education, organizing sessions inspiring students about future careers, identifying barriers prevention pupils from advancing to secondary school education. Primary responsibility, schools, NGOs, and local government. Expected output, an increased proportion of schools successfully transitioning to secondary education. Our strategic objective, number 4, is increased proportion of young people gaining employment. We will support youth in acquiring skills and securing employment in the following areas. Offering training programs delivering market relevant skills, creating opportunities for practical experiences through internships, and providing resources and mentorship for young entrepreneurs. Primary responsibility, vocational training institutes, businesses, and NGOs. Expected output, increase employment rates among youth. The third objective, reducing drug and substance abuse among adolescent and young people. We will implement comprehensive We will implement comprehensive strategies to combat substance abuse in the following areas: launching educational campaigns on the dangers of drug abuse, advocating for development of job opportunities and job programs to reduce engagements in drug abuse, promoting family-based prevention strategies, primary responsibility, community healthcare workers, schools, and family organizations. Expected outputs: a reduction in drug and substance abuse among adolescents. The sixth objective is increase community awareness on ending triple threats. We will engage communities to raise awareness in the following areas: organizing discussions and campaigns focused on addressing triple threats, supporting youth in advocacy efforts to raise awareness, collaborating with influential leaders to promote messages against triple threats. Primary responsibility: community leaders, youth organizations, and NGOs. The expected output is increased community engagement in efforts to combat triple threats, fostering a healthier environment for youth. Thank you.
Happy